Welcome to another edition of Inside Guyana. Today our camera crew is led by Richard and includes our good friend here, attorney at law from New York, Jonathan Sabrine, who is joining me in this program. Our special guests in the program Inside Guyana are Professor C.N. Purandare, the president of the International Federation of Obstetrics and Gynecology, and our own Dr. Carl Niamatali of Guyana. I forgot to tell you, ladies and gentlemen, that Professor C.N. Purandare is a professor in India, and he came all the way from India to see us here in Guyana to tell us a little bit about cancer prevention. He had an earlier lecture here at the Georgetown Public Hospital Corporation, and we are in the new maternity section of the Guyana Georgetown Public Hospital Corporation building. And I would like to ask you to please join me in welcoming our guests. Professor on my immediate right is Professor C.N. Purandare. Professor, welcome to the program Inside Guyana. It's a pleasure having you, sir.
My pleasure to be here.
Professor, Dr. Carl Niamatali, welcome to the program Inside Guyana.
Thank you,
Our
Dr.
good
Rudy.
friend on my extreme right there is Jonathan Sabrine. Jonathan, we are here to ask a few questions and listen to the professors here today. Are you ready for that?
I am certainly
Good.
ready.
So, ladies and gentlemen, there was an earlier event here at the Georgetown Public Hospital on cancer of the cervix, preventable cancer, at which the Honorable esteemed Professor Purandare from India gave an astounding, important and amazing, palatable, inspiring lecture. The Minister of Health, Dr. George Norton, was present, and many other doctors, and we decided that after this we should be able to steal some minutes from Professor Purandare, because he's very busy, and ask him a few questions, because he was invited here by to Guyana by the Guyana Cancer Prevention Society, of which Dr. Carl Niamatali is the president. So, Professor Purandare, the first question to you: why do you think cancer should be prevented when the population of the world is growing so rapidly and people are thinking that maybe we need less people here?
There are better ways of reducing population than making them die through cancer. Cancer is a disease, and if you talk in terms of reduction in population by disease, then there was no need to prevent polio, measles, whatever, all the infections, and people would have died anyway. So where is the need for prevention of anything if you want the population to reduce by death being the factor for reducing the population? We are talking about the prevention of disease per se. Population explosion can be prevented by family planning and various other means of control of population. And if any human being has to survive all his life in a healthy life, that's what one must aim at, and which means that it is necessary to make sure that they are prevented from getting preventable diseases. And there will be some diseases which may happen anyway and eventually may cause death. But something which can be prevented from causing death should be prevented.
Professor, that was just an opening question. I mean, just start the ball rolling. But you've been in Guyana for a short period, and I'm sure you read quite a lot about the situation in Guyana, the health situation, and you would be able to probably advise our viewers on some of the challenges that you know facing the Guyanese population here in terms of the prevention of cancer.
Well, any underdeveloped country in the world has its own challenges. The challenges are multifold in terms of not able to diagnose patients early, patients not coming in time for early detection of the cancer, and lastly the infrastructure available for further treatment of malignancy. Today in Guyana, it's a low-income country with difficulties of infrastructure which are present there. Today, if any cancer which requires further treatment, you need to flow them out of Guyana to some other country to get the treatment. So there are multifold problems which are there. No solution can be found out instantaneously, and it is a long-drawn endeavor and effort that needs to be done to make sure that you win over the cancers.
Dr. Karl Niamatali, President of the Guyana Cancer Prevention Society, can you enlighten our viewers, please, as to the aims and objectives and some of the challenges that your organization probably embody?
Well, thank you, Rudy. We formed the Guyana Cancer Prevention Society because we recognize that cancer poses a huge public health challenge, and there are a lot of things being done, but we felt in terms of treatment and early detection that the way to go is prevention. We know that 80% to 90% of all cancers are preventable. So obviously our objective number one is to increase public awareness, as the Minister said tonight, and Professor Purandare, that if we increase the awareness and people are aware of the issue and challenge of cancer, the second thing is taking responsibility for your own health. And once you do that, then what choices do we make? Number one choice is prevention. So Minister spoke about these: tobacco, alcohol, better nutrition, more physical activity to prevent obesity, which is a main driver of cancer, sexually transmitted infection, and tonight's lecture, cancer of the cervix, is spread by a sexually transmitted infection. So there are many more sexually transmitted infections that can cause cancer. In fact, there are 5. And there's a second vaccine that's available, hepatitis B vaccine, and hepatitis B can lead to cancer of the liver. So the idea is to promote public education to prevent cancer. Environmental pollution is another one. Sun sense. Skin cancer is the #1 cancer diagnosed worldwide, which is preventable in terms of thing. So the idea is all about prevention. Prevent the preventable cancers. Secondly, we want to have a screening program because early detection can result in cure. So if we pick up a cancer early, it's curable. And then in addition to the screening program, we will look down the road to set up a palliative care program. Why is this so? In addition to 80% of cancers being preventable, we know in low middle-income countries like Guyana, unfortunately, 80 to 90% of all cancers present with advanced stage disease, stage 3 to 4, which is not curable. So the thing is, they need palliative care. So those are the main objectives, and that's the main mission of the Guyana Cancer Prevention Society. And towards that end, we felt that the #1 cancer we should address, which is preventable, is cervical cancer. And there's no person who is more qualified, in my opinion, who has that strategic, overarching view of what needs to be done than Professor Purandare. So it's a real privilege and a pleasure to have him here.
Indeed, fortunate to have him here and delivering such a wonderful lecture. I think we should have more of that. What would the Guyana Cancer Prevention Society be doing in the near future and in the long term to assist in getting cancer out of the Guyanese society, away from all Guyanese, cancer-free Guyana. And in addition to that, can you tell us how can the public-spirited people and businesses participate in your program?
Well, as I said, the idea is prevention and screening. Those are the two big things by increasing public awareness. And so we'll have a series of education programs in the media, the print, electronic media, public lectures like this to increase awareness. And we will hold training sessions as well, training people. And Professor's visit was a catalyst in meeting with the Minister of Health this morning, and very in-depth discussions on how we move forward and how we address a lot of the problems involved in not only in terms of cancer, but in terms of maternal child health, reducing maternal mortality, and other issues that face the medical profession. So Professor has agreed also to have FIGO assist us in several of these endeavors. With regards to the question of how other people can be part of this movement and this program, we will reach out to them. Anyone can become a member of the Guyana Cancer Prevention Society. It's quite simple. You pay $1,000. You get membership for a year.
Guyana dollars or American dollars?
I wish it was American dollars, Rudy, but $1,000 Guyana dollars. If our good friends in the US would like to donate, whatever it is, we're open to it. Everything will be transparent. We have very good people on board. As Minister said, he looked at the list of people who are part of the Guyana Cancer Prevention Society. There's at least 8 doctors and some other excellent people. And so we believe that we will be able to make a difference. We're looking for support, financial support, because we need to do these programs. Some of them are not cheap. But I believe that we have the goodwill of the people, both here in Guyana and the diaspora, who are going to work with us. You asked what else were we going to do? The other program that we are looking at after this cancer of the cervix prevention program is breast cancer, which is the #2 cancer. And one of the issues we have in Guyana is that we are not able to do the estrogen, progesterone, and HER2 receptors. So I've spoken to a friend of mine in California who is going to work with us and some other institutions in the US, this Stanford University in California, Georgetown University and Lombardi Cancer Center, and Memorial Sloan Kettering have all indicated their willingness to work with us. And of course, my alma mater, Galway University Hospital in Ireland. They will partner with us and help us to do training programs and to set up a lab so we can do these tests. Because you cannot treat breast cancer effectively if you don't know the estrogen, progesterone, and HER2 receptors. So that will be a major advance in terms of treating breast cancer patients with current best practices.
Before we go to Jonathan Sobrine with his questions, or additional questions, I would like to ask Professor one simple question. Professor, you've been around the world, you've been involved in so many important medical institutions and activities to help people become healthy and to prevent them from getting sick and all of that. How would you use all your skills or some of your skills and expertise and relationship to assist the Guyana Cancer Prevention Society? Have you thought about that?
The oncology committee consists of 8 people which are from all the regions, from Latin America to North America, going down to Europe, Africa, Asia, Oceania. And the oncology committee works throughout the world for the betterment of women as far as cancer is concerned. And I've already told him that the oncology committee would be happy to work along with the Guyanese Cancer Prevention Society to make sure that we make the difference for the women in Guyana.
Right. Do you have a similar society in India?
We have many societies in India. We are the main Federation of Obstetric Gynec Societies of India is the largest, one of the largest societies in the world, which has 32,000 obstetrician gynecologists who are members of the association. And they have their own 27 different committees, including the oncology committee and so on, which cater to everything that happens in India. And FOXI is affiliated to FIGO. FIGO is the principal organization with 130 countries, which India is one of them. Unfortunately, Guyana has no OBGY society, so I have been trying to push them to start, and I was happy to hear, I discussed this in the morning, and I was happy to hear Minister say that he would also like to see the Guyanese OBGY society being formed and being affiliated to FIGO. Go.
Yeah. It will be formed.
Yeah, and affiliated to FIGO, which would be a major game changer as far as the country is concerned.
Thank you very much for that advice. Jonathan, do you have any additional questions for Professor or Dr. Carlin?
Yeah, I have a question for both, but I'll start with the Professor first. Professor, first of all, your lecture earlier was very, very persuasive, very, very influential, and lots of us took a lot that we didn't know before back home with us. Question for you, I noticed when you're making a slide presentation that I couldn't help but notice that China has over 1 billion people there, and the scale, when you're looking at cervical cancer between, and drew a mental comparison between that of China and Guyana, or the underdeveloped or lesser developed countries, I noticed a vast difference in the population-wise having cervical cancer. Could you comment on that? What would be such a vast difference between China and Guyana? I'm talking in terms of population in China versus population in Guyana or another third world country.
When you look at the countries like China or big countries, which are they are no longer in the underdeveloped category. They have infrastructure, they have finance, they have planning which supports their infrastructure for healthcare in the country far more than what the underdeveloped countries can do, like Guyana. Even though the population is very large in China, the infrastructure available to do that is far greater than that in those who are in underdeveloped countries. So you tend to see the underdeveloped countries having a large population of cancer undetected.
So you can honestly say, therefore, the Guyanese population, the Guyanese government can take cognizance of the infrastructure that's in China on a macro level, and for lack of a better term, on a micro level, administer that to the Guyanese population with almost the same results. And you think that's very possible?
Well, everything is possible. If there is a will, there is a way.
Okay.
And everything is possible. If you look at the finances are available from the country's resources as well as internationally funding that is available. So if there is a will to do something, there is a way, and you get the finance to do that, to implement everything. Because if you're talking about vaccines, and if the country cannot afford to give the vaccines, as I mentioned to you, Gov will be able to give it to you at subsidized level. And that subsidized level, you could get some donor somewhere to get that funding done as well, because eventually it will work out to be free for your country.
Thank you. And that's a great segue to my next question to Dr. Niamatali. Doc, earlier on, I heard the Minister of Health, Dr. Norton, he mentioned that available in Guyana right now, we have about 6,000 vials, I would imagine, of the HPV vaccination. And my thinking, and I may be universal in my thinking, is that if the general population is not made aware of the positive effects of the HPV, especially with children between ages of 9 and 30, especially young children in our culture and society? Do you get a lot of pushback, or do you get a lot of pushback from the parents preventing their girl child from having that vaccination?
That someone of Professor stature as president of FIGO, and FIGO is the world authority where this is concerned, and FIGO has come out quite clearly and endorsed the vaccine. For the cost of the vaccine, 2 vaccines, it's the best life insurance policy you can get for less than $10. Nothing else beats that. Because the tragedy of losing a daughter, a sister, a mother, a cousin, whatever, aunt, from this terrible cancer, which is preventable, is not acceptable. Of course, the vaccine is not compulsory. We will explain to people, we will educate them and say, look, this is the best choice to make to prevent this cancer. For us, it will be a huge step forward to prevent the #1 cancer in women in countries like Guyana, low and middle income countries. It's a huge step forward if we can take that cancer off the table. So I don't really see the problem. Professor mentioned the cost through his good office of FIGO, in contact with Gavi and the Ministry of Health, who Minister said quite clearly is supporting this program. We need to look at novel ways and be creative and see how we can reach out to various organizations, funding agencies, to get the vaccine, either donate it or get it at a reduced price. You have 500,000 Guyanese in the diaspora. If each one of them were to fund one person here to be vaccinated, we'd have everyone covered in Double Creek time. So we would depend on people like you and Dr. Rudy, who have great connections in the diaspora, to work with us, help us to reach out to the diaspora, to bring them on board so that we can deal with this problem and take this cancer off the table.
Thank you, Doc. Over to
Yes.
Dr. Rudy Jadoopat.
Well, we're coming towards the end of our program, and I normally would choose to allow my guests or the guests in this program to have the final say before I give the closing remarks. So, Professor, this is your opportunity to look at our viewers in the eyes and give them your address, whatever you want to tell them from your heart.
This is my 4th visit to Guyana, and I personally feel that the health scenario in the country can be improved drastically, not only in terms of the cancer prevention of cancer cervix, which is a major burden in Guyana, but many of the other situations, such as reduction in maternal mortality, to family planning, to prevent early pregnancies, having gap between the 2 pregnancies, and wherever there has been morbidity, such as fistulas and the interior of Guyana, where the obstetric care hasn't been adequate. And it's time that we make sure that the auxiliary nurse midwives and the nursing staff and the doctors in the peripheral are well trained and to give adequate service to women of Guyana. They deserve the best, and there is no reason why it can't be given.
Thank you very much. And now, Dr. Niamatali, your address to our viewers, please.
Well, I think the Guyana Cancer Prevention Society is a very important step on the road to having a program that will look at how we can prevent cancer. The whole idea is prevent the preventable cancers. And also to have a comprehensive screening program, because early detection is curable. Those are the main things. So we ask for the support of everyone to come on board, support with us, partner with us, so we can put together a comprehensive cancer prevention program and strategy to deal with this problem once and for all. Thank you.
At the new maternity block of the Georgetown Public Hospital Corporation, this is yours truly reporting, Dr. Rudy Jadoopat, reporting for the program Inside Guyana, Inside Georgetown, Guyana, and thank you very much to our special guests in the program Inside Guyana. Until later, bye-bye for now.
मधुर तुम्हारे